wrap up what we've experienced in this half-day summit together and to give some direct calls to action and ways to get involved, please give a warm virtual welcome for Brian Perry and Emily Allen. Brian and Emily, welcome to the virtual stage.
Thank you, Jill, and it's good to be here. Well, thanks to Jill, to all the panelists today. It's really good to be with everyone virtually with our logistics. I certainly wish we could be doing it in person, though I admittedly am really enjoying doing this without shoes. So with that said, look, we have organized this group over the last 14 months as sort of a national focus group consisting of senior advocates, healthcare providers, community organizers, and public policy experts. Starting this conversation from a standpoint of shared experiences and expertise was really the crucial first step and something for which everybody at this virtual summit should be proud. I will type you exclamation points. But frankly, look, we could have a conversation highlighting isolation as a national crisis every month for 10 years. And unfortunately, that would not make a dent in the lives of seniors. But I want to challenge all of us to join together, sort of move beyond just the conversation phase and push for real, measurable, and actual outcomes to improve the lives of seniors nationwide. Importantly, science and data are catching up with the anecdotal evidence that we all know to be true. And we know for a fact that senior isolation is indeed a social determinant of health. Addressing isolation will absolutely lead to improved quality healthcare outcomes and the quality of life for our nation's seniors. But we can't do it alone, and we cannot do it in a vacuum. We need to develop real policies as a group. We need to work strategically as a group to find paths for implementation of those policies, and we then need to push them forward together. You may have heard we had an election a month ago. It sort of feels like a year, but look, seniors were a vital voting constituency with the ability to swing the outcome of the election. There were lonely seniors with Trump signs in their front yard, and there were isolated seniors with Biden signs in their front yard. I personally had a Lisa Marsh Ryerson sign in my front yard, but the point is, the issue of senior isolation crosses party lines, which means it will require bipartisan and sound solutions. This election is bringing a lot of new faces and new ideas and new opportunities for progress on healthcare and social issues to both Washington, D.C. and to our state capitals. Whether you're a Republican, Democrat, or an independent, public policy in 2021, from healthcare to infrastructure and everything in between, will be shaped by this horrendous COVID-19 pandemic, with a major focus given to the tremendous burden that the 65 and older population has faced. Within that context, isolation and loneliness have had increasing exposure, perhaps more than ever before. I was reading the chat box, and Kathleen Winters said something very, very pertinent. Quote, "The silver lining of the pandemic is to bring social isolation and loneliness to the forefront." Absolutely true. It's true in the press, in the public eye, and with growing attention from public policymakers at all levels of government. So when Congress, our nation's governors, and state legislators get down to work in the first quarter of next year, this will be an issue that will be in front of them, and it will behoove our nation's seniors for us to insert ourselves into those conversations. There's an old worn out phrase among interest groups in Washington that remains true. You can be at the table or you can be on the table, and we owe it to our seniors to be at the table. It's in our best interest as individual citizens and as members of our own organizations to remain organized, grow our influence, and begin speaking loudly as a group together toward addressing isolation, toward actual policies that improve lives. So most importantly, that is in the best interest of seniors in America. And I think that is really why we're all here in the first place. 2021, it'll be a year of jointly developing best practices, draft policies, and corresponding mechanisms for enacting those measures. So sure, we can attempt to do it alone, but I think we all know that the best way to impact change with the policymakers and the others in power positions will be to remain organized and move forward together. So with that in mind, moving forward together, I want to bring in our great partner at the AARP Foundation, the wonderful Emily Allen.
Thank you, Brian. Oh my goodness, what a day we have had. From the kickoff with Holly and Lisa to the two panels and to Vic. I mean, what a day. And I want to build on that theme. You're absolutely right. We cannot do this alone. That has been a consistent theme today, hasn't it? And we've certainly appreciated partnering with ProMedica on both this issue and other social determinants of health in big ways like the Root Cause Coalition, or in smaller ways where we're testing out new solutions and demonstration projects. It doesn't have to be a big splash at first to build out that evidence. And it's really forums like this that help drive that message home. But unless we do things differently, to your point, I'm going to build on that point too, starting now, unless we do things differently and think differently, we are really at risk of not having the impact that I know we all desire to have. I really go back to Lisa and Holly's conversation and ensuring that we are putting older adults at the center. I love that quote that you just said about you're either at the table or on the table. And I think you're absolutely right. Older adults of all means, but particularly those most vulnerable in our communities, must be at the center of our thinking, and that we are building solutions not just for them, but with them. So I challenge everybody that has attended today, who are you doing this for, and who are you doing this with? I've been fortunate to be in community-based services at the very start of my career. And I always have in my mind one person who impacted me many, many years ago when I started in the older adult space. And I have her at the center of my thinking. So I really challenge you, who needs you right now? Who may not have the resources, and who is getting left behind? I think that to me is a driver for how I do things differently. You know, as you heard from Lisa earlier during our opening session, earlier this year, the National Academies of Sciences, Engineering, and Medicine issued a consensus study that we sponsored, AARP Foundation sponsored, and focused on the impact of social isolation among older adults. And there were several key recommendations, but two of those are top of mind for me as I think and reflect back on the conversations that we've had today. First, we've got to develop a more robust evidence base. And I think this goes into your policy discussion as well, Brian. We've got to know what's working and what makes the most difference in order to affect what policies need to be in place. And then obviously we need to strengthen the ties between the healthcare system and community-based networks and resources. It is really through these partnerships that we can develop that evidence base. It requires and demands, quite frankly, that cross-sector groups come together, each providing their own value and assets to develop the solutions that result in the desired outcome of addressing this public health crisis. As Lisa said earlier, and as everybody knows, this crisis was here before the pandemic. And I love the quote that you pointed out about, you know, the fact that if nothing else, if the silver lining is of this crazy time we're living in right now, is that it's really highlighting this need. I think you clearly heard that across all of the panels this morning. I encourage, from AARP Foundation's perspective, and I think I saw it in the chat, for attendees to visit connecttoeffect.org to learn more about how some of these partnerships have formed, because that's always a challenge. You know, there can be, some obvious players, but sometimes it's looking beyond the obvious partners and going deeper and understanding how do you form a partnership and how have some of these solutions been developed. That last recommendation in particular highlights the important fact that no one group can combat this public health crisis alone. That to truly address social isolation and impact the lives of millions, we're not talking just a handful, we're talking about millions of older adults who face this every single day, that we must work together. To that end, I'm so excited that Kelly Cronin was able to take part in the earlier panel. But as you heard, AARP Foundation has been working with the Administration for Community Living and numerous other organizations, including many of the attendees on this webinar today, like N4A, Leading Age, NCOA, too many others I always hesitate to start mentioning organizations because there's too many to mention. But among others, to develop a public-private coalition that will work collaboratively on a nationwide effort to address social isolation. The coalition will consist of organizations dedicated to improving engagement, well-being, and access to services for older adults. That's something that's top of mind for us at AARP Foundation. This isn't just about reducing social isolation to reduce social isolation. It's making sure that older adults and people living with disabilities can access those critical services in communities nationwide. So we are so pleased to be helping developing the coordinating center, which will organize efforts across sectors and across organizations with the goal of reaching literally millions of socially isolated older adults and people living with disabilities, and connect them with appropriate informed solutions to decrease isolation and loneliness. There could not be a better time for this. And as you can tell, I just get really excited and jazzed by the potential. What I'm excited about too is, as you heard, the coordinating center would develop a support a nationwide network of local champions and organizers like those of you all in attendance today. So we will be with you every step of the way to help support your interest in your efforts, learn from those efforts, and bring them back to have that type of collective impact that I know that we want to have. So we look forward to sharing more about this important effort in the weeks ahead and continuing to collaborate to not just address social isolation, but eliminate it as a public health crisis. So I cannot thank you all enough for joining us today in this important conversation. And I look forward to continuing to work with all of you as we go forward to tackle this important issue.